They've worked tirelessly throughout the pandemic and received warm public praise.
They continue to do this with care and compassion day in and day out, and they're working extraordinarily hard over extraordinary hours, and I really want to thank them.
But for some, those words seemed hollow. Last night, the ABC revealed dismay from the capital's nursing union that frontline health staff who have contracted the virus were having to use their personal leave before special COVID-19 leave entitlements would kick in. It sparked anger on social media.
Fair enough if we contracted it in the community, but we are caring for COVID-19 patients day in and day out and have no hope of proving we contracted the virus through direct patient care.
It's no wonder so many staff are leaving this industry. They are overworked and underpaid. Now our government, who thinks that a mere thank you in press conferences is enough to keep them on board, are dealing yet another blow to our most valuable workers.
And outrage from the opposition.
Our nurses have put up with a lot during this pandemic. They went into the pandemic overworked and exhausted, and now the government is failing them.
Yesterday, Canberra Health Services said the leave arrangements are in line with ACT public service guidelines, and today those guidelines changed. Now staff can take up to 7 days of COVID-19 leave before using their personal leave if they're still too unwell to work. The union sees it as a step in the right direction, but just the tip of an iceberg of problems, particularly what they say are potentially dangerous levels of overtime being worked and not monitored.
I find it astounding that CHS does not know its liability and the impact it's having in terms of overtime hours worked by nurses and midwives at this stage of the pandemic.
And when it comes to COVID, that pressure isn't likely to ease quickly. Though new daily cases were below 1,000 for the first time in 10 days, with 892 recorded today, there are now 62 people in hospital with the virus, including 3 in intensive care. However, authorities now think the ACT may have reached the peak of the Omicron wave, and the plans for the return of students to classrooms next month is now expected to be made next week. Harry Frost, ABC News, Canberra.